Okay, this video is to announce my new book, Prevent and Reverse Hypertension. The cover's not exactly the way I wanted it to turn out, but it's still pretty good. It's a picture of Jesus Christ's Sermon on the Mount by Carl Bloch, as well as The Raising of Lazarus, also by Carl Bloch. Okay, so for this book, some of the things I do is right on the first page, table of contents. No BS, no filler, no testimonials by a bunch of, people, whatever, okay? Real simple. What causes hypertension? Like for any disease, if you want to get the cure, as Dr. McDougall would say, you got to avoid the cause. Okay? Hypertension and heart disease, exercise, Spartan vegan diet. Sounds simple, and it's actually pretty easy. First, a disclaimer: if you're taking any pills for blood pressure, diabetes, anticoagulation, or you have kidney failure, you got to let your doctor know before you change your dose, because you're going to have to titrate your dosages. Otherwise, you could drop your pressure or your sugars, your blood sugars like a rock, and pass out. You don't want that. This book's for educational purposes only. I'm not your doctor. I'm just providing you with information to help improve your health if you choose to do so. Okay, chapter number 1, what causes hypertension? About 100 years ago, we knew what causes hypertension. If you read the textbooks, they still teach medical students that 95% of hypertension is idiopathic, meaning the doctor's an idiot and the patient's pathetic, that it's unknown, also called essential hypertension. That's all nonsense. We've known back since, the article in The Lancet, 1929, by Donison, C.P. Donison, 1,800 consecutive admissions. In Kenya, black patients. Blacks are off the charts hypertensive in the United States. There's not a single patient, zero, that was hypertensive. And the average Kenyan man, 60 years of age, had a systolic blood pressure of 105. So they were 105 over 67. Average European at that time was 140 over 90, mildly hypertensive. Okay, and the average Kenyan had the same blood pressure as a teenager. So this goes way back. We've known the truth about hypertension for 100 years. It just never gets into the medical textbooks. Over 75 years ago, Walter Kempner showed low-fat, low-sodium diet dramatically lowers blood pressure and often successfully treats systolic pressures over 200. Okay, so we've been able to control that. Not in all patients, but in a large percentage of them. Okay, over 50 years ago, Nathan Pritikin, Roy Swank, Peter Quo, Meyer Friedman, Ray Rosenman, they all showed that fat makes red blood cells stick together, and when you reduce the dietary fat, pressure improves. Okay, so again, I'm making the point that this has been known for a long time. 40 years ago, Nathan Pritikin, John McDougall were able to take 90% of their patients off hypertensive medicines. So the stuff I'm telling you is not like some novel idea. It's not some gimmick. This has been known by educated people for 100 years, okay? And it's just been confirmed over and over again. Over 40 years ago, Richard Moore, MD, PhD, showed high sodium diets cause dysfunction in plasma membrane and vascular smooth muscles by dissipating the sodium battery of the plasma membrane, the electrochemical gradient, and by just reducing dietary sodium, increasing potassium, which happens when you eat a plant-based diet and you avoid the processed food. You improve your blood pressure dramatically. You want to have a K factor, ratio of potassium to sodium, of like 10 to 1. Okay, he says 5 to 1, but I think 10 to 1 is better. And it's pretty easy to achieve if you're eating a vegan diet. He makes the point that vegans almost never have hypertension. Low-fat vegans, they don't get hypertension if they're that way from a long time, since childhood, okay? These are the references, so all the references are here. If you want to double-check them, look them up yourself, or buy these other books. You'll see everything I'm telling you is I'm understating the case, how good your odds are. So it's not a mystery what causes hypertension. High-fat, high-sodium diets are the main cause of hypertension. That's well known. That's been known for a long time. What typically happens to the average patient is they expect their doctor to save them, and they end up taking all these pills, and then you become a chump. It's like becoming a cash cow for the pharmaceutical system. You basically get milked every day for money to take your meds, and you have to take them for the rest of your life. The cure rate for pills is 0%, zero. You cannot cure a dietary disease with a pill. The only cure is to improve the diet. Okay, it's a nice painting of a cow there, made milking by Gerhard Terbrugge. Okay. Here's just, the scenario, like you walk into a building and one of these tourist buildings or something, you see a map of yourself. You are here. And then it's your choice to take the path. Smart people go low-fat vegan, and everything's as good as it's going to get. The chumps, typical chumps, keep eating the meat and the processed food. Then they go to the doctors, get drug. Drugs don't work. They get surgery, chop. Bye-bye money, premature death, okay? And you could also say that this is God's way, okay? We're Genesis 1:29, eat a low-fat vegan diet. Every plant I have put upon the earth is food for you. And this is man's way. It's expensive and it doesn't work, okay? And basically, to be or not to be a low-fat vegan, low-fat, low-sodium vegan, that's the question. With no oil, no alcohol. Whether it's just nobler in the mind to be healthy or to be fat, sick, and stupid like most Americans. You don't want to be the average dummy, okay? All the patients in the hospitals have the same disease, almost all of them. They're hypertensive, pre-diabetic or diabetic. That causes atherosclerosis in the brain, in the heart, and everywhere else, and they suffer terribly for it. Why do that? Why not just eat the diet we're made to eat and be healthy? Okay. Okay, here's a curve of like what you can expect. The longer you've been hypertensive, the slower your blood pressure is going to come back down to normal. Okay, your weight is also going to take a while to come back down to normal. Your blood sugar can rapidly improve, just in a day. Your blood pressure might come down that fast, but it's probably going to take longer. If you've been hypertensive for decades, you've got calcified arteries, hypertrophic, vascular smooth muscle, it's going to take much longer. It could even take months. But you got to be ready and monitor it closely because it could come down a lot sooner than you think when you simultaneously drop your dietary fat, drop your dietary sodium, increase your dietary potassium. Okay, so you got to work with your healthcare provider to titrate your dosages. Again, if you're on anything for hypertension, for diabetes, or for anticoagulation. Okay, because over time you'll have lost the Windkessel effect. Windkessel effect is the elastic recoil of the ascending thoracic aorta. It's like a second heart. When the left ventricle contracts, it stretches outward. Then by elastic recoil, it recoils inward to generate diastolic flow, and that keeps a narrow pulse pressure, the difference between the systolic and the diastolic number. So what I'm saying is you can't replace those elastic fibers after you've come of age, 20 years of age. So the longer you've been hypertensive, the more likely you have lost your Windkessel effect in your ascending thoracic aorta. A Windkessel, by the way, is the thing you blow air on, looks like an accordion onto the kindling little wood pieces and coal in a fire. That's what a Windkessel effect is, okay, that elastic recoil. So you have lost that if you've been hypertensive for decades. So again, you're going to be less likely to get your pressure to come totally down to normal. But you can still dramatically improve it to get yourself out of the danger range for strokes and heart attacks. Okay. I think we'll stop right there for the first part of this, and I hope you found that helpful. Thanks.
Are you ready for dinner?
Yeah.
Okay, I know. Do you want to change your clothes?
Yeah. I just gotta send this video though.
Sure.
Oh crap! I think you might have got on the video. I think I forgot to stop it. Fuck. Let's see if I did. If I did, I won't. I don't think we saw your face. Let's see.